Hello, it's 11 a.m. here in Seoul. I'm Oh Seong at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Sejong government complex with simultaneous interpretation available for you in English. We're going to go into the briefing room now, where Kim Gang-lip, Vice Health Minister and overall coordinator of the Central Disaster and Safety Countermeasure Headquarters, will be sharing the latest figures and updates on the COVID-19 situation in Korea. So here at Sejong government complex, it looks like Kim Gang-lip is just about to start the briefing.
We also have sign language translation available. First of all, here is Mr. Kim Gang-lip with the briefing on the COVID-19 response.
6월 17일 수요일 정례 브리핑을
Let us now begin our regular briefing for June 17th, Wednesday. As of today midnight, we have new local transmissions amounting to 31 and 12 imported cases as well, and a total of 43 new cases have confirmed. And the total number of confirmed cases now stands at 12,198. So far, a total of 1,145 people are in quarantine undergoing treatment. Unfortunately, we had one more fatality and the death toll now stands at 279. I extend my deepest condolences to the deceased and the members of the bereaved family. This morning, KSDC held a meeting presided over by Prime Minister Chung Se-kyun, and we discussed many agenda items, including the review of the quarantine measures in the metropolitan area, as well as medical equipment supplies here in the metropolitan area, and the quarantine measures for the door-to-door sales business establishments. And Prime Minister Chung Se-kyun has also highlighted that under all circumstances, we need to have a joint process of private and public cooperation scheme. And in particular, he stressed that in the process of securing the number of live treatment centers and hospital beds and medical staff, he said the cooperation between the government and the private sector, and including the citizens of the community and corporations, is of utmost importance. And we have also some updates on the domestic cases. To date, as of today midnight, we have 31 local transmissions, and about 25 of them were the cases in the metropolitan area. And recently, we are seeing an increase of the number of cluster infections in the metropolitan area, increasing steadily, and we also continue to witness sporadic outbreaks here in the metropolitan area. We believe that we are curbing further spread of the COVID-19. However, our spread of tracing the contacts is a little bit slower than the pace of the spread of the virus. And to this end, we exert our full efforts to curb the spread of the virus and delay the spread of the virus, and also to have fully and fast and swift diagnosing of the patients. And we are also exerting our full efforts to identify the blind spots of quarantine measures, and we have put in place inspections on some of the areas that lacked quarantine measures, including the restaurants set up at the construction sites and the offices for the one-day laborers. And if there are breaches, we will be reacting to these business establishments with stern measures, including legal actions. And we also have mandated the QR code-based visitor log for many business establishments in the metropolitan area. However, realistically speaking, it is impossible for the government to inspect all of the business establishments. Therefore, in order to curb the further spread of the virus, the cooperation from the business sector as well as the residents of the metropolitan area are very crucial. So we continue to ask the residents in the metropolitan area to refrain from gathering and engaging in other social gatherings, and please practice personal hygiene measures, including wearing face masks and distancing. And as for the business establishments, all of the managers and the visitors need to comply with the quarantine measures, including the mandatory QR code entry log, as well as ventilation and distancing and face mask wearing. And lately, we have seen one of the major causes of the COVID-19 spread in the metropolitan area due to the door-to-door sales business establishments. And these business establishments are prone to the risk of COVID-19 inspection because they have regular gatherings or meetings to train the employees. And it is difficult for the government to fully have an overview of these offline gatherings. And therefore, we have established a detailed guideline protocol for these business establishments. And as of now, we have done our inspection for about 8,000 of these business establishments nationwide. And we also put in place our administrative orders on 27 facilities that breached the quarantine measures. And going forward, we will continue to intensify our quarantine measures against these door-to-door sales business establishments. And we ask the members of the public, especially including the senior citizens, to not visit these facilities in the future. And here are some of the updates of our response to the lack of hospital beds in the metropolitan area. Currently, we don't have a clear difficulty or challenge in the number of hospital beds. However, we have 21 critical condition patients, and we have about 46 hospital beds available in the metropolitan area. And as we have an increase in the number of elderly population of the patients, we are also preparing ourselves to increase the supply of hospital beds. And we currently have 969 hospital beds available in the metropolitan area. And we have about up to 3 life treatment centers in the metropolitan area that could also administer patients in the future. And in line with these measures, we also have put in place our response measures, and these are in line with the guidance and the protocol that have been implemented in the Daegu and Gyeongbuk province, which saw an exponential increase in the number of patients. And on top of this, we also have secured a sufficient amount of personal protective equipment and other medical equipment. And lately, we are witnessing increase in the number of global COVID-19 patients, and we have more imported cases as well. As for all of the entrants to Korea from abroad, even though you don't have the symptoms, please get tested and please abide by our mandatory testing procedures. And as for the foreigners who are staying in Korea for a short term, we are mandating them to be administered at the quarantine facilities for 14 days. And at these facilities, these people will be isolated from the public completely, and they will be released only after testing positive. And so about now, more than 14,000 foreigners have used this facility. However, we have had no single case of community transmissions. However, we believe that there were some possible concerns from the community and the residents. And they also were concerned about a possible spillover effect in terms of economic aspects, and they also raised some public concerns. However, please remember that these temporary stay shelters for short-term stay foreigners are very essential for the protection of the Korean citizens. So we ask for your support going forward. And the government will also continue to toughen our quarantine and control and management over these facilities. Yesterday, the KCDC has been updated and elevated to a major central administrative order. And to this, this guidance has been passed by the cabinet meeting yesterday. And thanks to these measures, we are able to intensify our expertise going forward. And we believe that in the latter half of this year, elevating the KCDC into a central administrative organization, and we believe that this is very crucial in order to increase our expertise and capability going forward. And from the first outbreak of the COVID-19 in the Republic of Korea up to now, we have been fully exerting our efforts to combat the virus here in the country. And together with the government in organizing the organization of our KCDC as an administrative order, central administrative organization, we will continue to cooperate fully with the Welfare Ministry as well as other ministries, and we stay concerted efforts to exert our full efforts to comply with these measures, and we will exert our full efforts to implement any of the policies that are needed to combat the COVID-19, and we ask for the public's participation as well. Thank you very much.
That was a live briefing from the South Korean health authorities that we just heard, informing us that there were 43 new cases of COVID-19 infections, bringing the accumulated total to 12,198. There was one additional death from COVID-19, bringing the total death toll to 279. That wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back shortly with our regular newscast at 12 p.m. Korea time. Bye for now.